Hi everyone, I'm Dr. Caitlin Harmon, one of your care providers at Grow Health. Welcome to our clinic. I'm sure that you're filled with excitement and nervousness, just like all pregnant women are. Today, I'm going to review some information about genetic screening options for your pregnancy. This is a subject that many couples find overwhelming when they first learn about all the options. This video will provide you with an introduction to the topic, and all of this will be reviewed at your first prenatal visit as well. And please remember, genetic conditions are very rare, and your baby is probably perfectly healthy. The main thing to remember is that all of these options are exactly that, optional. We encourage all patients to make any decisions about genetic screening after having time to discuss and review the options at home with their partner. Typically, there's quite a bit of time between your first prenatal visit and the time that you would be going for any of these tests that you may choose to do. As well, all of this testing is dependent on the stage of pregnancy you're in. So oftentimes, we will need to get the results of your first or dating ultrasound to know your exact due date and current gestational age of your pregnancy before we order any of these tests. This ultrasound is commonly ordered at the first prenatal visit and usually performed in the ultrasound department around 7 to 12 weeks of pregnancy. An ultrasound at this time is very accurate in dating a pregnancy. This information can then be used to calculate the timing to go for other testing, including the detailed ultrasound, typically at 18 to 20 weeks of pregnancy. Please note that these are approximate times for the standard 2 ultrasounds in pregnancy, and some patients may end up going for these or additional scans at other times for a variety of reasons. So here are your options. For most women, prenatal genetic screening involves 2 blood tests, one done in the first trimester at around 10 to 13 weeks, and one done in the second trimester at around 15 to 17 weeks. For some women, it may also involve a special ultrasound done in the first trimester, called a nuchal translucency, which measures the thickness at the back of your baby's neck. This is done around 11 to 14 weeks. This screening tells you the chance of your baby having one of these conditions: trisomy 18, trisomy 21 or Down syndrome, or problems with the baby's spine and brain, like spina bifida. In BC, all women are offered what is called SIPS, or Serum Integrated Prenatal Screen. This test is comprised of 2 sets of blood tests I just mentioned. Since the risk of chromosomal disorders increase with age, women 35 years or older at the time of expected delivery and women that are higher risk for other reasons are offered the IPS, or Integrated Prenatal Screen. This test includes both of the blood tests as well as the nuchal translucency ultrasound. Occasionally, if women present to care at a later stage in pregnancy, they will be offered the quad screen, which is just 1 blood test. So which prenatal screen you will be offered depends on how far into your pregnancy you are and when you first see your doctor, as well as your age, health history, and whether or not you are carrying more than 1 baby. The cost of these screening tests is all covered by MSP, and the results are usually available about 10 days after the last test is completed. These tests do not give a yes or no answer. Instead, they give you a risk score, for example, a 1 in 1,000 chance of Down syndrome. The detailed ultrasound, done at 18 to 20 weeks, that I mentioned earlier, is also actually considered part of the genetic screening test. Most women choose to do the standard screen and don't even realize it's checking for genetic disorders, as well as many other things, including the gender. During the scan, every part of the baby is carefully examined to ensure it's growing and developing as expected. The ultrasound can tell you whether the baby has an open neural tube defect, like spina bifida, as well as check for the other factors that may indicate increased risk for genetic disorders I mentioned earlier. It's important to keep in mind that prenatal screening tells you the chance that your baby may have one of these conditions. It does not tell you for certain that your baby will have one of these conditions. You would need a diagnostic test to find out for sure. Most women who choose to do prenatal screening tests get a result showing that chances are very low for these conditions. About 1 in 20 women, or 5%, who have a prenatal screen done will have a result that suggests their chance of having a baby with one of these conditions is high enough that they may consider either diagnostic testing to find out for sure, or another new screening test with higher accuracy, called the Non-Invasive Prenatal Test, or NIPT, which is currently self-pay. NIPT is a new blood test that measures the amount of fetal DNA circulating in maternal blood. It is known by the brand names Harmony or Panorama. NIPT is typically done early in pregnancy around 10 weeks, but it can be done at any time, and results are available about 10 days later. It accurately provides a screening risk for Down syndrome, trisomy 18, trisomy 13, and sex chromosome abnormalities. The Down syndrome detection rate is over 99%, with a false positive rate of 0.1%. It's not yet covered by MSP and will cost the patient several $100s. It's typically ordered if the pregnancy has already been deemed high risk due to other screening test results or various other reasons. Occasionally, low-risk women choose to go for this screening test as they would like the added peace of mind at an early stage in pregnancy. There are also a few other private pay options you can do that will give you more information by 12 to 13 weeks of pregnancy. If you're interested in hearing more about these details, please do not hesitate to ask your doctor. As far as diagnostic tests go, they are normally only ordered if the screening test results are high risk or there are other factors that make the pregnancy high risk. These tests are typically able to offer a definitive diagnosis, but they are associated with a small risk to the pregnancy. One of these tests is called amniocentesis. It involves sampling the amniotic fluid that's surrounding the baby with a long, thin needle guided by ultrasound. DNA testing can be done on the baby's slough skin cells that float in this fluid. It's associated with about a 1 in 200 or 0.5% increased risk of miscarriage due to the procedure. It's usually performed after 15 weeks of pregnancy. Results are available in a couple of days or longer, depending on exactly what testing is done. Chorionic villus sampling, or CVS, is a diagnostic test in which an ultrasound-guided needle is put into the woman's belly or the vagina and used to collect a small piece of the placenta known as the villus. As with amniocentesis, it can usually tell you for sure whether or not the baby has a genetic disorder that has been identified as high risk on the screening test. However, there's also a small risk with this, about 1% chance of miscarriage with the procedure. It's usually done around 11 to 13 weeks, and results are available in the same time frame as amniocentesis. That was a lot of information for you to take in, but don't worry. As we said earlier, this will all be reviewed at your first prenatal visit, and you'll have an opportunity to ask many questions, and then go home and think about it all before making any decisions. And again, please remember, these conditions are all very rare, and the tests are optional. We are just here to help you sort through all the information available to you. I hope we've provided you with a good taste of what to expect at your upcoming first prenatal visit. See you soon.